hair is sticking.
I know, that's how I feel.
But nobody can really.
You look good. I like your hair like that. Let's talk about Melissa's hair.
Let's not, because I have like these crazy fuzzies, because all my hair falls out every time I have a baby, and then I get like up here, and then I get these like weird.
Are you gonna have more?
No, I can't.
3's a good number, I think.
I know. I really want another one only because.
Okay, people are on.
Oh,
Okay.
here we are.
Let's talk about it.
Okay. I think we're live. Are we live, Karen?
Yeah.
Okay. Awesome. Good morning, everybody. Thank you for joining us again for our Stein Wealth Advisors monthly webinar. We have a really awesome guest here today. Her name is Nancy Glicksman of Blue Peak Insurance. Many of you may actually know her or have had interaction with her already. Nancy and I have known each other for, it's definitely been more than 10 years now.
Yeah, I think it's been like 15.
Yeah, and quite frankly, I can't even remember how we met, but I know, it may have been through one of the networking organizations that I worked through. But Nancy's worked with us and a lot of our clients to help them really navigate and understand their health insurance. She's been a really great resource to Stein Wealth Advisors and continues to be a great resource to our clients as well. She specializes in healthcare, Medicare, specifically group benefits, as well as doing some limited individual policies. Today, what she's going to talk about is general information on Medicare, how do you apply for Medicare, enrollment periods, different parts of Medicare, parts A, B, C, and D, Medigap Plans, D's your prescription drug, and the IRMA. So what's the IRMA again? The
Income-related monthly adjustment.
I always forget the exact
Yes.
like long name there. But in any case, she's going to keep it pretty informal today, I think. And we don't have to get through all those things. If you have questions, we're going to pause occasionally, and we'd love for you to interact with us. So Nancy, we want to welcome you today, and I'm going to turn it over to you.
Great. Well, thank you so much for inviting me. I appreciate it.
You're welcome.
And I am very passionate about this topic. Medicare is so confusing to everybody. So if you're confused, you are not alone. A lot of people refer to Medicare as a maze because you have to figure out how to get through the maze. There's all different parts, all different letters. People don't know what the letters mean, when they can apply, how they can apply, what they should get. And there's no right answers. And then when you're turning 65, you get all these materials in the mail. And sometimes you get phone calls.
Oh my goodness, our clients call me, they're like, all these people are calling me, what do I do? And I'm like, just stop.
I know.
Like, don't answer their phone calls.
Exactly. And then you have the well-intentioned friends and neighbors who tell you what they have. So they think you should get what they have.
Yeah.
And there is no one answer.
Mm-hmm.
The most important thing, I think, is for people to educate themselves about Medicare, think about what's important to them, and then that will help you pick the plan that will work best for you. Because what's best for me is not going to be what's best for you.
True.
So you really have to think about how you feel about healthcare, and we could talk more about that in a few minutes.
Okay.
So I prepared a few different things I want to cover, but I also want to answer people's questions. So feel free to put your questions in the chat box, and we can stop. I want it to be very informal. Okay,
Perfect.
so a few things, just some general information about Medicare. It started in 1965, and it's Title 18 of the Social Security Act. It's for people who are 65 years old and older. I find a lot of people think you could take retirement earlier, so they think they're eligible for Medicare earlier.
Like if they take Social Security at 62.
Exactly.
Yeah, I hear that a lot too.
But you may not get Medicare until you're 65, or if you are receiving Social Security disability benefits. So I have clients who are under 65 who are receiving Social Security disability benefits. After 24 months of receiving benefits, you are also eligible for Medicare.
Oh, and do you have to be fully disabled?
As
No,
long
just
as
any
you
disability.
qualify for the
Okay.
disability. The other thing is people who have ALS, which is Lou Gehrig's disease, or end-stage renal disease,
It's an automatic.
automatically get Medicare. There's some variables as to when they qualify based on diagnosis. So how do I apply for Medicare? That's a big question. And there's a few different ways. If you are already taking your Social Security benefits, when you're getting Medicare, you will automatically be enrolled in Medicare A and B.
Okay.
You will get a card in the mail about 3 months before your birthday. You do not need to do anything if you're going to keep A and B. You just keep the card.
Rip out the card
and that's it.
Okay.
Put it in a safe place.
Okay.
If you are not taking Social Security benefits, which I'm finding more and more people are not taking it at 65, you have to apply for Medicare A and B.
Mm-hmm.
You can either do it online by going to socialsecurity.gov. You could go into a local Social Security office, and I'm not sure if they're open.
Good luck with that right now. Probably not happening.
But you could call Social Security and schedule a phone consultation.
Yeah. And what they'll do is like set up a time and call you back, right?
Absolutely.
Yeah.
So the best thing to do is to try and do it as early as possible, because Social Security administers Medicare. And sometimes it's not easy to get through to Social Security. So again, to get A and B, you have to go through Social Security. Sometimes my clients come to me and say, will you sign me up? I can't sign them up for A and B. There's only one A and B. It's not like you have a choice. You're signing up for A and B. And I'm going to talk about what A and B are soon. So far we're good? No questions?
No. Carol, let us.
Okay. Okay. The other thing I want to say on a side note is it's helpful to create a Social Security account now. I'm not eligible for Medicare yet. I already have an account. I work closely with a woman from the Social Security office and do a yearly webinar with her. And she said that by creating a Social Security account, it helps prevent identity theft. So you could be 25 and create a Social Security account.
That.
Yes. And you go online, they ask a lot of questions. I kept failing my personal questions.
Mm-hmm.
I kept getting locked out.
Yeah, that happens. Mm-hmm.
So when you're close to 65, I tell my clients, set it up as soon as possible, because you need to have it set up to go online to apply for Medicare.
Well, and I'll be honest, I actually like our clients to have it set up for other reasons too, because we're trying to get Social Security projections. And when I'm helping them enroll for Social Security, it's a lot easier to do it that way as well. So, I mean, I think everyone should really be doing that.
Absolutely. Absolutely. Now, I want to talk a little bit about the enrollment periods for Medicare. So when you are initially eligible for Medicare, so you're turning 65, let's say I'm turning 65 January 15th. You are eligible for Medicare the first of the month in which you turn 65. So I would be eligible January 1st. Medicare is always effective the first of the month. Now, the one exception to that is if my birthday was on January 1st, I would be eligible December 1st.
Oh.
So for everybody whose birthday is from the 2nd to the end of the month, they're eligible the first of the month. The only exception is if your birthday is the first of the month, you're eligible the first of the preceding month.
Okay.
Okay? So let's say my birthday is January 15th. I'm eligible January 1st. I'm turning 65. I can apply for Medicare 3 months before, which would be starting October 1st, the month of, and 3 months after. There is a 7-month period. It's called an initial coverage election period. I obviously recommend people do the 3 months before. So I say start October 1st, you apply, you get your card, you're all set, and then once you have A and B, I could help you with the additional benefits you need.
And that helps them figure out when to stop their old coverage too and start the new coverage so that there's a better plan in place instead of waiting until the end.
Exactly, exactly. So that's the initial period. Now there's also a period called the annual election period. That is coming up. That is every year between October 15th and December 7th. So every year, people who already have Medicare, not who are new to Medicare, but people who are already enrolled in Medicare, can change to a different plan during that 6-week period, and the new plan will start January 1st. Because Medicare is always calendar year. It doesn't matter when you sign up. If you sign up in October, it will go October through the end of November, and everything resets in January. So the AEP is coming up. It's a crazy time. You're going to see a lot of annoying commercials on TV constantly about all the plans, all the changes. You'll get more information in the mail. And that will be a reminder that it's time to reevaluate your coverage. And every year I have my clients look at their prescriptions, look at the doctors, make sure it still works. Because if you want to make a change, you have to do it in that period.
Well, and you really should be looking at it every year, right? I mean, I find a lot of clients are like, well, I've had this plan for 3 or 4 years, but maybe their health situation has changed and they keep just getting the same policy. And maybe it was like a higher deductible plan, and maybe they could switch to something with better, like more coverage if they're having more health issues, and it might save them some money. Is that true?
It depends. You could switch between certain plans easily and not other plans. So it depends.
But either way, they should probably be looking at it every year, no matter what, and understand what it means to them.
Because networks change. Doctors leave networks.
Right.
Prescription formularies change. So you have to reevaluate.
You can't just set it and forget it.
Exactly. Exactly. The other period I want to talk about, the other enrollment period, is called a special enrollment period. So that's if somebody's working and they're 68 years old and they have not had Medicare because they have insurance through their company. They then have a 2-month period to apply for Medicare and to enroll in a Medicare plan. Now, most people, I get a lot of calls, if I don't sign up for Medicare when I'm 65, am I going to be penalized? If you have credible coverage, you're a full-time active employee, and you have coverage through your employer that is as good, if not better than Medicare, you will not have a penalty when you do apply for Medicare at 68 or whatever age. I had a woman who came in to see me yesterday who's 89 years old, and she decided she might retire.
She's still working?
She is still working.
What does she do? Oh my
She
goodness.
works as a receptionist, and she loves it. It's her interaction with people.
Yeah.
But she's had Part A, but she has not had Part B. But she will not get a penalty because she's had coverage through her employer. Now, if you retire and you keep your company insurance, you still need to get Part B. So you have to be an active, full-time employee to not sign up for Part B.
Okay.
And then when you do sign up for Part B at a later age, there is a different way to apply. And I don't want to get into too much detail. I don't want to be going off on tangents here. Should I just stick to the program?
Well, I guess the one thing I would ask you is, because I do have more and more clients working past 65, and they have credible coverage through work. What is the situation where that client would get penalized? So, like, let's say that, so you're saying if they're 65 and they have credible coverage through work and then they retire at 67, they don't need to do anything at 65 to notify Social Security.
Well, they could apply for Part A.
Okay.
So a lot of people who are still working do enroll in Part A.
So they should.
However,
yeah.
Nothing's easy.
This
right?
is where I know this situation does come up. So
okay, so Part A is your hospitalization. Part A does not cost anything if you've been paying into your Social Security taxes for 10 years or 40 quarters. Okay. So there is no cost for Part A. If you are still working, most people get Part A unless they have a health savings account. Right. So there are certain group plans that are called HSAs, or health savings accounts. If you have an HSA, do not enroll in Part A. Because if you have an HSA and you're on Medicare, you may not contribute to your HSA. Any other type of plan, get A. There's no downside to A. You're not paying for it. Do not get B if you're on a group plan until you're planning to retire. Once you retire, even if you're offered COBRA, get B. B. If you're working full-time, no, B. If you're not working full-time, yes, B. Is that confusing?
Yes. Here is, and I do understand, we've had these conversations.
Right.
You've been great at educating me. So here's the moral of the story. Just call Nancy. Because it's different for everybody. And you might want to just double check and or at least call a professional and talk to somebody about this because it is more complicated. And there's all these weird little nuances. And if you don't know about that, you might make a mistake.
Exactly. And it's also important to talk to your HR department if you're working. Ask them. I mean, a lot of them have experience working with people who are older than 65, and they'll know about health savings accounts if you should get A. So I always tell people, go to your HR
Use them
department.
as a resource.
Right. Make sure you could stay on the plan once you're Medicare eligible. Some small groups say no, you need to enroll in Medicare.
Okay.
Usually groups over 20 say, yes, you could stay on, but it might vary. So talk to your HR department.
So someone would get penalized if they worked till 67, got off of their group plan, and then tried to get back on Medicare. Is that where they would get penalized?
No, if they work till they're 67 and applied for Medicare, then there would be no penalty.
Let's say they didn't. Say they were offered like some other plan or COBRA.
Okay, then
I'm trying to figure out where they would get penalized once they turn 65 and then they continue working past that. How would they actually get penalized?
If they're not working, here's where you're going to get penalized. So you're 67 years old and you're not working.
Okay. But
and you never applied. And then I have clients.
Okay.
I've had people come in to see me.
They just didn't have insurance.
Well, some people have to pay for Part A because they haven't paid into their Social Security taxes. And if you have to pay for Part A, it could be over $400. So they never signed up for Medicare. So if you don't sign up for Medicare and you don't have other coverage, there is something called a general enrollment period.
Okay.
And you have to do it between January 1st and March 31st, and it doesn't start till July 1st, and you have a penalty. Okay. So sign up on time to avoid that.
All right.
And if you have questions, so we're going to
move on. I'll stop asking. Yes, we're going to move on.
So different parts of Medicare. So Part A is the hospitalization, okay? And that's the one you pay nothing for as long as you're paying into Social Security. If you just had Part A, you would roughly have a deductible of $1,400 and have to pay per day in the hospital after a certain number of days. So not enough just to have Part A, right? Part B is the medical, the doctors, the specialists, the outpatient surgery, the testing, the rehab, the durable medical equipment. All of that falls under Part B. There is a cost for Part B, and that's why if you're working, you don't take it because you don't want to have to pay for that. The average cost this year, and it changes every year, I don't know what it will be in 2021, but in 2020, it's $144.60 a month. If you're taking your Social Security, it automatically comes out. If you're not, you will get a quarterly bill in the mail from Social Security of $144.60. Now, some people pay more than $144.60, and that's where the IRMA comes in. IRMA stands for Income Related Monthly Adjustment Amount. If your individual income is above $85,000 or your joint income is above $170,000, you pay more for Part B and for Part D. And depending how much higher your income is, depends how much more you pay.
There's a couple more hurdles too.
Exactly.
So we have some clients where we're doing like Roth conversions and other things like that. We have to be really careful to not only not go over their top bracket or stay within their bracket, but we try to stay under those Medicare limits too, which aren't even aligned with the tax bracket. So it makes it even worse. So if you miss that, you could be $5 over the $170,000 and you're paying a couple $1,000s more per year.
Exactly.
So it's something to definitely be keeping in mind.
And here's where it gets really complicated. They're looking at your joint income from 2 years back. So if you're applying for Medicare this year, they're looking at your 2018 income. So I have people who come to me who retire, but they're looking at the income from when they were still working. So every year they reevaluate it. So in 2021, they'll look at your 2019 income. you can appeal IRMA, and you can successfully appeal IRMA, especially if it's a one-time inheritance or a sale of a property or a sale of an investment. Where it gets tricky is if it's your employment income. But I've had people win on that. Yeah. So it's always worth trying to appeal your IRMA. You might not win, but you have nothing to lose.
I agree.
Okay. So if Part B, you have a deductible of $198 this year and you're covered at 80%. So once you have A and B, you have coverage, but not enough coverage. So if you do not have insurance through your work and you're an individual, you need A and B. Those are prerequisites before you can get a supplemental plan, okay? There are two ways to go to get Medicare supplements. One is called a Medicare Advantage plan, which is called Part C. We're getting into the alphabet now. And the other is a Medigap plan. So I'm going to start with Part C, which is a Medicare Advantage plan. These are plans a lot of you heard of. UPMC for Life, Freedom Blue, Security Blue, Community Blue, Advanture, Aetna, Humana, AARP. They all have plans. They have HMO plans. They have PPO plans. To get a Medicare Advantage plan, you need A and B. These plans include prescription drugs. These are calendar year plans. The plans change every year. The new plan designs are released tomorrow, October 1st for 2021. A lot of these plans include dental, vision, hearing aids, gym membership, over-the-counter benefits. You get a catalog and you can order items. Some have meals. Some have non-emergency transportation. They throw in extras that Medicare does not cover. Every year as the plans change, you get what's called a notice of change, and it explains how your plan is changing every year. With these plans, you could pay less each month, but now as you use it, you're paying. You go see a PCP, you have a copay, a specialist, you have a copay. In the hospital, you have a copay. Your MRI, you have a copay. So every time you use it, you are paying.
Because some of these plans have actual zero premiums, correct?
Correct.
You actually don't have to pay for it.
That's right.
But if you do use the services, then there's more out of pocket.
There could potentially be out of pocket depending on the plan.
Okay.
Yes.
Depending on
the plan. But yes, and people say, how could it be $0? And the reason it could be $0 is some of that Part B money that you're paying for to Social Security is going to this plan. So if I enrolled in Community Blue, they will take some of my Part B money and give it to Community Blue. So Community Blue is getting money for me.
Just not
from me, correct. But with these plans, yes, you're going to pay less each month for most of the plans, but as you use it, you will have more expenses, potentially. Now, I have clients who have MS that swear by these plans. They love it. They use it a lot. These include prescriptions. This is all you need. So you pay your Part B and you pay your premium for this plan. You need to check to make sure your doctors, your hospitals, your diagnostic centers, everyone you care about is in the network. You need to make sure your prescriptions are covered. So those are Medicare Advantage plans in a very brief nutshell.
Yes.
Okay, and that's called Part C. But they include D because they're including your prescriptions.
And probably just, I know people think about this, I've seen premiums range on those from $0 to $300.
That's correct. And you have to look at all the variables. Sometimes when I tell clients like about Medicare Advantage plans, and this is where you have to think about your own needs and what's most important. Some of them have a hospitalization per day copay, and you pay up to 6 days. Some have a hospitalization per stay. You pay one amount no matter how long you're in. Some of them they all have what are called maximum out-of-pockets, which mean if all your medical expenses, not prescriptions, but if all your medical expenses reach a certain number, you're done for the rest of the calendar year. Some are lower, some are higher. So you have to look at everything. You have to look at how much you use it. How much do you travel? Do you need to have out-of-network coverage? With an HMO plan, you can go anywhere you want for an emergency. So if you're out of state, you could go as long as it's an emergency.
So if you're a snowbird and you're in Florida, what if there's an emergency?
You could go.
Yeah.
You could go to urgent care and you could go to emergency room. The key is you perceive it as an emergency. As long as you perceive it as an emergency, it will be covered. Okay?
Mm-hmm.
So, but all of that has to come into play when you're looking at what type of plan you want to get. And that's why there's no one plan for everybody. Okay, so one way to go is to get Part C. You have A and B, and you get Part C, which includes your D. The other way to go, which is the original way people used to go, I mean, a lot of your parents had these plans, and they're called Medigap Plants, which are truly what are referred to as Medicare Supplements. These are standardized plans. These plans don't change every year. The rates will go up every year, but the plan design will not change. The rates are based on your age. So there's a certain age at 65, 66, 67. Whereas with the Medicare Advantage plans, it's the same rate, no matter how old you are. With Medigap plans, you could go to any doctor, any hospital, anywhere in the United States that accepts Medicare. So remember, Medicare is national. It is not international. So anywhere in the United States that accepts Medicare. So God forbid you're diagnosed with something and you want to get a second opinion at the Mayo Clinic or wherever you want to go. With Medigap, you don't have to worry about it. As long as they take Medicare, they will take your plan. Medigap plans cover only what Medicare covers, though. They don't throw in those extra bells and whistles. And even like for an annual physical, they call it an annual wellness exam. And it's a little different because that's how Medicare covers it. For women, for GYN exams, you can't go every year preventative. It's every other year. So you have to read on what does Medicare cover. But with Medigap plans, you're paying more each month, but now you're not paying as you use it. So there is a plan, there used to be a plan F, which is no longer for sale for people who are new to 65. The plan that replaced it is G. The only responsibility you have for a calendar year is the Part B deductible. And then you're covered in full. So you're paying more each month, but you're not paying as you use it. You also need a prescription plan with Medigap because they don't include it. So it'll be a more expensive way to go monthly, but it might end up not costing as much. And the one other thing, I know this is such an exciting topic for all of you. I apologize, but I'm just trying to get all this information.
No, this is really great information. I think people are genuinely very interested.
Okay, yes. I know it's very boring, and I wish I could.
Oh, well, finance is even more exciting, Nancy.
That's true.
I mean,
That's true. You are more boring.
I am. I'm a little bit more boring.
But with Medigap plans, and this is an important thing, if you are new, if you're just turning 65, or you're just enrolling in Part B because you're on a group plan, if you are within a 6-month period, you can automatically get Medigap with no medical questions asked. And you're accepted at the preferred rate. But let's say you don't get it then, and you go, and 3 years later you decide, I want Medigap now. Now they're going to ask medical questions. They could rate you up. They could turn you down. So that's why it's important to understand this is an option that's available now, but Medigap might not always be an option for you.
So if you turn 65 and you get a Medicare Advantage plan, you can't really easily switch back to the Medigap plan
Correct.
After that 6-month period.
Correct. So, but if you start with a Medigap plan,
you can.
With Medicare, to go to a Medicare Advantage plan, the only question they used to ask for a Medicare Advantage plan is, do you have end-stage renal disease, which is kidney disease, which I believe in 2021 that question is going away, which is exciting. So to go from Medigap to Medicare Advantage, piece of cake, as long as you do it during the annual enrollment period. Okay. But the other way can be more difficult. And my clients are evenly divided. I have healthy clients who never use it, that want Medigap, and I have clients with severe medical needs that get Medicare Advantage.
Yeah, it just depends on the client situation.
Exactly.
Well, and probably the financial resources available as well.
Exactly.
For some people, it probably makes sense to have the lower premiums.
Yeah.
Okay, that's very helpful.
Okay, so any questions?
Yeah,
Are
we
we
want to see if
still?
there's any questions. Does anyone want to throw any questions out there?
I'm taking
know-
coffee.
Yeah, I know a lot of times
No?
people are, well, they might be formulating their thought, but people usually have really specific questions, I
Right.
find. So we'll see. They're probably going to call you after and
Yeah.
call you. So, okay.
I'm just answering all the questions, I guess.
That's what it is.
That must be. Let me talk about prescription drugs.
Yeah, that's good. The donut hole and all of that.
Exactly. So Medicare prescription drug plans work very differently than group health insurance or individual under 65 prescription drug plans. So it doesn't matter how you get your prescription. If you get a standalone with the Medigap or if you get it with your Medicare Advantage plan, the rules are the same. Okay. The only way to get out of the coverage gap or the donut hole is if you are low income and you qualify for a low income subsidy, or if you qualify for a program through the Pennsylvania Lottery called PACE or PACENet.
Okay.
When they say helping elderly Americans, there is a program called PACE and PACENet. You can make a little more money than Medicaid.
But it's still pretty low limits.
It's still pretty low, but you can always call them. They do an application over the phone. They're wonderful. It will lower your prescription drug costs. Outside of that, the rules are the rules. And I'm going to talk about ways to be creative, but just let me explain the rules. First of all, there is a difference between prescription drugs Part D. Am I doing okay with time?
Yeah.
Okay. And prescription and Part B. So there are two different medications. Part D medications are prescriptions you get at the drugstore. You pick them up at the drugstore. Part B, like boy medications, are chemo drugs that are administered in a doctor's office, infusion medications.
So even though they're drugs, because they're being administered like in a professional environment, they're not part of that D plan.
Correct. All right, so that's important to differentiate. So Part B drugs would fall under your Medicare Advantage plan or your Medigap plan. Part D drugs will fall under your prescription plan. They all have tiers. So like you prefer generics are the least expensive, which are tier 1, then 2 are generic, and then brand, and so on. There's usually 5 tiers. And depending on your medications, depends on what the tier is and what you pay. A lot of these plans have preferred pharmacies. So you want to check the pharmacy to make sure you get the lowest copay by going to the preferred pharmacy. Now, how it works with prescription drug plans and Medicare, some individual plans have deductibles for the more expensive medications, but I'm not even going to talk about that. You start out and you have your copays, right? You pay your amount. Let's say it's $10. You're paying your $10. When you get your prescription from the pharmacy, on the back of your envelope, when you pick up your medication, it will say you have met $10 of your total drug cost. When your total drug cost adds up, this year it's $4,020. Next year it's going to, that's why I have my notes here, $4,130. You will be in the coverage gap or the donut hole.
The total drug cost or the total drug cost to you?
That's a great question.
Okay.
The total drug cost. So let's say
I didn't know it was on the back of that envelope.
It is.
That's a really good I never look. I ripped the prescription.
Well, you don't see it because you're not on Medicare. It won't be on your envelope.
Right.
But once you're on Medicare, it will be on their envelope.
Okay, that makes sense.
So let's say I paid $10 for my medication and the insurance company paid $190.
It's $110.
It's $20, right? That is my total drug cost. I only paid $10, but they paid $190. So on the back of my envelope, it will say I met $200 of my total drug costs.
You can get up there pretty quickly.
Exactly. I might have spent $500, right? But boom, because of what they paid, I'm in the coverage gap. Once I'm in that coverage gap, I am paying 25% of all my medications.
For how long?
Until I get to the next level,
Which
is the catastrophic level. Now, the catastrophic level this year is $6,350. Next year it's going to $6,550. But here's the bad part. Logic has you think you go from the 4020, you pay 25%, to the 6,350. Wrong. They changed the rules. Initially, they're looking at the total drug cost, and to get to the catastrophic, they're looking at your cost. So they're going from the 500 I spent initially, I'm paying 25% till I get to 6,350. So I could be out of pocket $4,000 or $5,000. I finally get to the catastrophic level where it's much cheaper, and then boom, the end of December, it starts all over again.
Yeah, I have seen this negatively impact people, especially if they're more on a fixed income. It really, and they have a really expensive prescription cost. It really, I mean, it's extra $500, $400 or $500 extra a month that they have to spend on that instead of doing fun stuff for retirement. So.
Exactly, and the problem is there are all these copay cards you're not eligible for once you're on Medicare. So the pharmaceutical companies don't offer the same things to people on Medicare because they're not allowed to, because it's a government program. So I tell people, before you get off an individual plan or a company plan, if you can get a 3-month supply, stock up on your medications. Use the older medications first, if you can do that. There is a website called GoodRx. It's a free website. You go on, you type in your medication, you type in your milligrams. It tells you where you can get it, what the cost is at all different pharmacies.
We should put that in our resource center online.
You print a coupon, you go, and you get it. Like example, my son, who has an allergy, needed an EpiPen. He called in his prescription to Giant Eagle. I went to pick it up for him. It was like $350. I said, what? I said, I'm not picking it up. I went to the office. I typed in EpiPen. At Walgreens, it was $126. I clicked the coupon. I called Giant Eagle, had the prescription transferred. It was $126, which is still too much, but you save a lot of money.
Right. So if you do have to get something out of pocket.
Absolutely. Yes. Also, some pharmaceutical companies have foundations for people who don't qualify for low income, but they still have lower income. They will offer programs to you. So it always makes sense to call the pharmaceutical company.
And I remember we worked on that case together where that really helped somebody who had that medication was really expensive.
I think it was Enrollment.
Yeah.
Yeah.
And there's thousands of dollars per month, and you were able to help them make a connection with the company to get it. Was it for free?
It's for free.
Yeah.
Depending. So you really have to be creative. Don't just accept the price, is what I'm saying. You have to advocate for yourself. There are also Canadian pharmacies. I'm not recommending it. I'm just stating a fact.
Yeah.
And there's one in Elwood City that you can access online to get quotes on prices.
It's good to know. That's really good stuff.
Yeah. You have to be creative.
Looks like there's a question.
Okay.
All right, we got a question.
Yay!
Thank you, whoever did that question.
Okay. Is there a survey we can take to screen these plans for our conditions?
A survey to take discrete, like in terms of Medicare Advantage plans?
Yeah, probably. Like, is there a way you can go in and say, look, these are all the things that I have, or the prescriptions that I have? I know you can do that. What's the best plan for me?
Right. So in terms, you can't, there's nothing in terms of Medigap to compare the plans.
It's just Blue Peak Insurance. Yeah, right.
There is a very good website, which I would strongly recommend you create an account on. It's www.medicare.gov. You could create an account. You need a Medicare number to create an account. If you don't have Medicare yet, you could just look at all the plans. Now, tomorrow, all the 2021 plans will be listed.
Okay.
You put in your zip code. You could put in all your medications along with your prescription, like your milligrams, how many times a day. And it will list every plan for you, Medicare Advantage plans, and then there's a way to switch to prescription drug only plans. And it will filter it by lowest drug cost and premium cost. So you will be able to see that way. You also can see the plan benefits in terms of your copays. Conditions, they will cover you for everything. So it doesn't necessarily matter what your condition is, but what your prescription is would matter. But you would be able to access it that way. And
right, because all the Medicare plans, well, not all, Medicare A and B all covers the same thing. Supplements, They do as well, do they not?
Correct. It's the only thing with the supplements
Is
to
those
remember
extras.
is if you don't get it when you're first eligible, if you do have medical conditions, you probably won't be able to get a Medigap plan
Right.
at a later time.
Right. But other than that, they're standardized, so it doesn't really matter.
Correct.
Right.
Correct.
What your actual condition is.
Correct.
But the prescription matters. I'm just clarifying.
Right.
I know
It's
that
the
gets a little
prescription that, right. But, or if you're someone who gets like 2 MRIs a year, you want to look at the plan description and see what is the copay for the MRI.
Sure.
Or if you're someone who needs Part B medications, like chemo, you want to look at what is the Part B, and it's usually a 20% coinsurance. And what I
But you
will,
can't control the Part B, right?
unless you get Medigap.
Okay.
So what I will say is for certain people, like myself included, I am on a medication that's administered in the doctor's office. I go every 2 months.
Mm-hmm.
It probably costs over $5,000. If I were, when I'm ready to apply for Medicare, I have 5 more years, there's no question what would work for me is a Medigap plan, because once I meet my Part B deductible, boom, my
It's
medication's covered. If I go into a Medicare Advantage plan, I am paying 20% of $5,000 up to my out-of-pocket maximum.
Right. Okay.
So it's cut and dry for me, but it's not cut and dry for everybody.
Okay. Good question. Any other questions?
And did I answer that question? I'm hoping I
You
answered
did.
that.
Yeah, you go to Medicare.gov.
Okay.
Make sure it's Medicare.gov. There's a lot of
Yes.
weird sites out there that aren't necessarily as reputable.
And there are agents out there who sometimes have sites that look like a site.
They really do look like Medicare sites, and they're not.
Do not put your phone number on the internet
No.
unless you want to get 1 million phone calls.
Mm-hmm. I did that once. I got 1 million phone calls. Actually, Kara got 1 million phone calls. No, that's good. You know, I think I have a question.
Okay.
Because we have some clients who have VA coverage, and they use that primarily to get their health care because it's free to them.
Mm-hmm.
But does it make sense for them to have, if they're over 65, to have Medicare?
So, good question.
Mm-hmm.
I have a lot of clients
Mm-hmm.
with VA,
Okay.
and they can get what's called an MA only plan, which is still a Medicare Advantage plan
Mm-hmm.
without the prescription drugs, because they're getting their prescriptions
For
through the
free.
VA.
Mm-hmm.
And I can get them a $0 Medicare Advantage plan. It's not costing them anything. And it gives them the option to get health care outside
If
of
they
the
need
VA,
to.
if they wanted to.
Okay.
They're still getting their prescriptions. A lot of them still getting their hearing aids through the VA, but it gives them another option for health care at no cost.
Okay. I think that's important to have choices, right? We're always trying to
Absolutely.
get clients to have choices because you just
Right.
never know. I mean, the VA does great things, but if you have a serious condition, you might want to see somebody else, right?
Exactly.
Okay. Good. Any other questions? How are we doing on time, Kara? I think we're good. So, do you have any more comments?
I have just one more question. I tend to get a lot, well, a few things I wanted to touch on. Some people ask if they could go on their spouse's Medicare plan. No, no, no. Medicare plans are individual. So a lot of times, actually, I have couples, one person might take a Medigap plan, one person might take a Medicare Advantage plan, because that's what best meets their needs.
Mm-hmm.
You cannot go on a plan together. Some plans, some Medigap plans give a spousal discount if you're both on a Medigap plan. But otherwise, no, it has to be an individual plan.
And it doesn't have to be the same coverage either.
Exactly.
Because I know we've run into that before. Where client says, "Well, my husband has UPMC for life. Why shouldn't I have that?" But that doesn't make sense for that person because their situation's different. So you don't have to have the same Medicare plans to meet. You know, it's not like group insurance. That gets confusing for people because people are used to that group insurance.
Exactly.
Mm-hmm.
Exactly. And some people say, oh, once I get my Medicare Advantage plan, I'm going to drop my Part B. I don't want to pay for Part B. No, 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 no. You have to keep A and B.
Mm-hmm.
If you drop B, you're dropping your Medicare Advantage plan. So A and B are required to keep those plans.
Mhm.
And one last question. That's
Well,
it,
I have a question.
promise.
I have one or two more questions.
Okay.
Too, so,
Do I need a prescription drug plan if I am not on any medications? Yes, you definitely need a prescription drug plan. If you get a Medicare Advantage plan, it's included. Otherwise, if you get Medigap, you could get a very inexpensive prescription drug plan. If you do not take a prescription drug plan when you are first eligible, and then you take one later on, you will have a penalty that will be retroactive of 1% of the standard premium, and it will continue with you as long as you're on Medicare. Plus, you never know if you need a medication.
well, yeah, I mean, even if you're not taking one regularly, if you're sick and you need an antibiotic, I mean,
Exactly.
Okay, that's good. So I was thinking a little bit about something else, and you touched on it a little bit earlier, but vision and dental when you're over 65. I think you said that a lot of the Medicare Advantage plans include it.
Correct.
Maybe just talk a little bit about that, and if you do need supplemental coverage and what they cover, because a lot of our clients over 65, I mean, they might need like major repair work, and some of those plans don't even cover that. So I don't know if you could just talk a little bit about that, because I think we end up focusing a lot of times on like the actual healthcare coverage, but vision and dental could be pretty costly. So
Right. So first of all, if it's medically related, like glaucoma, cataracts, that falls under the medical.
Okay, that's helpful to know.
But if it's just vision, you just want to get your eyes checked.
New glasses.
Usually routine eye exams are covered with Medicare Advantage plans. And usually an amount of money is given to you per year or every 2 years towards glasses or contacts. Not with Medigap, we're talking about Medicare Advantage. In terms of dental, dental has become increasingly better. It has gotten better over the years with Medicare Advantage plans. Like there have been plans that they usually cover your cleanings and x-ray, and then they give you money towards comprehensive dental, and it varies. It could be
Like
$500 up to $2,000 depending on the plan. Your dentist and your vision provider have to be in the network or it's not going to work for you. Okay, so that's another thing we check.
So say someone has some really bad, or I don't want to say bad, but I mean, they have a lot of extensive dental work that they need to have done. Is there a way to get like a plan that will cover that? Or for the most part, it's just.
So there are standalone plans you could get. I find standalone vision plans pay for themselves. Standalone dental plans, unfortunately, don't, and there are waiting periods and there are maximums. There's something called dental discount plans that I have on my website that save you, and like sometimes up to 50% for root canals, bridges, crowns. You could check to make sure your dentist participates. You could use it from day one. There's no pre-existing and there's no maximums, and they're very reasonably priced.
Okay, that's good.
One thing I do recommend for people who are on a group plan, you could COBRA your dental and vision and not your medical. So I tell people, if you have group dental and vision is the way to go. That's going to be the best coverage. Keep it for 18 months. Then you'll have a period. You can always get dental and vision in the middle of the year. It's not like the Medicare. So then we could get you something else. Dental's usually discount plans as standalone. Vision, I usually do vision insurance if they get it.
Okay, that's very helpful.
So yeah, and with Medigap, you usually do not have the coverage for the routine dental and vision.
Okay. So you'd have to get a standalone plan. Okay. I think we covered a lot.
I do too.
I think that was very helpful. Are there any other questions? I don't see any popping up there.
No.
Did you want to add anything else?
No, I think that is it. If you have questions, I am happy to answer any questions. Melissa can share my information. I am going to be approaching my crazy busy time. I'm allowed to start talking to my clients tomorrow about the changes in plans. Medicare has strict rules. I can't talk about any changes until October 1st. And I can't make any changes to plans until October 15th.
Okay.
So I'm entering my crazy time, but if there's something you have questions about, or if you're new to 65, feel free to call and I'll figure out a way.
And I think what we'll do is when we send out the follow-up email with the replay, I actually want to put some of those websites that you mentioned on there, as well as I put your information on there too so that people can get it easily, because then they'll just have that. We can post it on the site as well. So I think a lot of people should be, if they're not turning 65, at least looking at their coverage now, and they're probably already getting inundated anyway.
Exactly.
I've already started to get some phone calls, so I'm assuming that'll start happening soon. But very informative. I really appreciate you taking the time to do this today. As always, learned a lot, and appreciate you being here. So.
Great. Well, thank you. And I appreciate being able to talk to people because, again, I think you have to learn as much as you can. Ask questions, read.
Yeah, just
and
knowing your options,
exactly.
right? Know your options and be informed. And we're the same way. So, and thank you everyone for attending today. Another one of our monthly webinars. We hope you keep joining us, and let us know if you have any topics that you would be interested in hearing about. You can always shoot us an email at info@steinwealth.com, or you could just call Kara and let her know what those topics would be. We're going to keep doing these. We really enjoy it, and we hope everybody's safe, healthy, and happy, and that everyone has a great day. Signing off.
Signing off.